This is a big day because Pfizer's vaccine for younger children is going to be approved for use in Canada. To talk about that and a few other pandemic-related issues, we welcome back infectious disease specialist from St. Joseph's Healthcare Hamilton, Dr. Zain Chagla. So this is the news a lot of parents have been waiting for.
Yeah, absolutely. It's good news. I think all the health units and provinces were expecting this was coming anytime in the next few weeks. Ontario is trying to do a schedule of 8 weeks difference between both doses, really to increase some of the immunity from the vaccine, but also balance against potentially some of the side effects like myocarditis, which are rare but may be balanced by spacing out doses. So yeah, good news. I think again, parents can be reassured. At least the information to date suggests it's safe. There's over 1 million kids that have been vaccinated in the States already. Again, as we talk about trying to get schools back to normal, sports back to normal, this is a really nice tool to make sure that everyone has the same protection from this virus.
And this is specifically for children 5 to 11, because you think of what a petri dish most schools are, right? You always hear back when schools go back in January and in September, everybody gets a round of some kind of illness. So it really makes sense.
Yeah, absolutely. Look, and we're seeing other respiratory viruses show up in school as well as COVID, right? And again, we can do the things we can do to prevent other respiratory viruses like good hand hygiene and better ventilation. But at the end of the day, we have a better tool to prevent COVID-19 and make sure that kids, A, are protected from spreading or even getting the virus, but B, even in the worst case scenario, that they're protected from serious illness, particularly kids that are vulnerable. So this is good news. Parents need to make the decision, look at the information, look at public health resources and make a reasonable decision here. But there's going to be a lot of information. There's going to be a lot of public health intervention. There's going to be a lot of discussion from the federal and provincial governments around this. So there's going to be lots of good resources for people to access to make that decision.
And again, it is not an adult-sized dose, right? It's about a third of the dose.
Yeah, absolutely. So when they did the studies, they looked at a third of the dose in kids, really to just mitigate some of those sore arm, fever side effects. But they did see that antibody levels in those kids, even up to the age of 11, were equivalent to that of the 12 to 15-year-old trials that got the full dose. So rest assured, if you have a big 11-year-old, it's still okay to give the low dose of vaccine to them because, again, their data was included in that analysis.
Okay, for the adult vaccines, is there a difference between a booster shot and a third dose?
Yeah, they are trying to make this distinguishing feature, particularly in immunocompromised patients. So, patients with compromised immune systems, giving a third dose as part of the first 2-dose regimen is what the objective is, right? So these are patients where at a third dose may actually make more antibodies than 2 doses. And we do this for other vaccines, like the rabies vaccine, for example. We give immunocompromised people 5 doses instead of 4 after an exposure. Then there is a booster dose. So these are people that have made a good response to the vaccine, but because of their age or other conditions, their immune system wanes a little bit. And the point of that dose is spaced out in time from their initial doses to give them an extra antibody response. So, immunocompromised people, this may be a 3-dose vaccine, even for naive ones that have not gotten a vaccine yet. But regular people, 2 doses, and then maybe a third dose down the line for those who are compromised, and probably for everyone else at some point.
You talk about antibodies. How is the clinic at St. Joseph's going?
Yeah, it's been going well. We've been reaching out to a lot of regional partners. So we've infused a lot of people through St. Joe's. We've infused a lot of people throughout the region of Hamilton, Niagara, Haldeman, Brant. We've given over 30 doses to date, and we're continuing to give more. And so, what we ask for people is just get tested. We've coordinated with the health units so that people have access to this if they meet criteria. But the first piece is getting tested and getting tested early if you have symptoms in order to access this therapy.
Okay, and this therapy, again, just for viewers who maybe haven't been following along every week, could you just explain it in 30 seconds?
Yeah, absolutely. So this is an infusion of antibodies to COVID-19. These are drugs that are approved in Canada and have been around the world for some time. And given to the right people, particularly high-risk people, we can reduce the risk of hospitalization by 70 to 80%. And get people to recover about 4 days faster than if they didn't get the drug. So really good benefits here. And again, we have to give it within 7 days of people
Okay.
having symptoms. So that's the biggest thing more than anything else. Get tested so that you can access this.
Very important information as always. Dr. Zane Chegla, thank you for joining us.
No problem. All the best.